I'd now like to introduce our speakers today for our Diabetes 101 seminar. Dr. Gwendolyn Jack is an assistant professor of clinical medicine at Weill Cornell Medicine's Division of Endocrinology, Diabetes, and Metabolism. She received her Bachelor of Arts degree from New York University. She earned her Master's of Public Health from Columbia University Mailman School of Public Health. She earned her medical doctorate at Sidney Kimmel Medical College in Philadelphia. She completed her internship and internal medicine residency at Johns Hopkins Bayview in Baltimore. She completed her fellowship in endocrinology, diabetes, and metabolism at Beth Israel Deaconess Medical Center, Joslin Diabetes Center at Harvard. She's unable to join us today, but we also have Regina Hanna, who received a Bachelor of Science in Nursing from the University of Mount St. Vincent in New York, and Master of Science in Nursing from Hunter College Graduate School of Nursing in New York. She is currently certified as a diabetes educator, transition and care coach, and health and wellness coach. Regina has been the recipient of multiple awards, including Diabetes Educator of the Year Award from the Garden State Association of Diabetes Educators. She has also received the Service Award from the Foundation for Diabetes Research for her 25 years of service. She has extensive experience speaking to groups of professionals and patients about diabetes. She currently serves as a volunteer and board member on several diabetes professional and community organizations. Please welcome Regina Hanna.
Good afternoon, everyone. I just want to speak to you on behalf of Dr. Gwendolyn Jack. She has laryngitis, and although she was really wanting to be here, she's on the phone, and so she's listening in and participating from her home, but she didn't want to put anyone at risk, and she certainly couldn't really speak. So she just sends her regards and wants you to know she's here and present during our talk today. So I'm very, very excited because it's National Diabetes Awareness Month. And as many of you who've come out today in this rainy weather know, the significance of preventative care and how when we are diagnosed, we really want to fully understand the principles behind a diagnosis, whether it's a family member or a neighbor or a friend or ourselves, so that really we have an opportunity to learn and hopefully take care of whatever diagnosis we have, whether it's pre-diabetes or diabetes. So today it's going to be an overview, and I want it to be kind of a friendly conversation. We will save questions to the end so we can get through the content, but hopefully please feel comfortable to ask any questions, and hopefully I'll be able to answer them, and Dr. Jack will be on the line. So today's outline, we're going to speak about defining pre-diabetes and diabetes, and we're also going to speak about the diagnoses of diabetes, the symptoms of diabetes, and the treatment of diabetes. And we're also going to talk most importantly about your role and the role of an education and team of educators, as well as your medical team, on how we can teach you the role of lifestyle management, which is an integral part of care. So let's just talk about some key words, because I think one thing that I really feel strongly about is when medical professionals speak sometimes, we have the habit of using a vocabulary that sometimes is not always familiar. So I want to talk about some basic words when it comes to what is diabetes and the key words. So first, we want to talk about what is glucose. We want to talk about it's a type of sugar all of our cells use for energy. And we also want to understand that we get glucose. When we get glucose, it helps us with our food. We get glucose from carbohydrate. We also utilize and make glucose in our livers. So that's something really important to also understand. Insulin. Insulin is made by cells in the pancreas, and the pancreas is the organ that is involved in metabolism and helps to produce the insulin. Allows our cells to make up glucose from our body and use it for energy. So Glucose is a source of energy, and it's very important that we have insulin to transport it into the cells so it can be utilized. And then stops our liver from making glucose when we are eating. So when we're utilizing and eating our carbohydrate and our pancreas is producing insulin, it signals to the liver to not produce additional glucose into our body and bloodstream. Insulin resistance is the tissues in our body are less sensitive to the effects of insulin. So our muscles and our fat cells don't necessarily utilize the glucose for energy in a way that's productive for our body for use of good energy sources. Sugar is not taken up from our body very well with insulin resistance, so therefore the glucose stays in our blood where it can't be used as an energy source. And then lastly, sugar remains in the blood where it can cause inflammation and also lead to other problems like heart disease because it develops problems with our organs and our vessels in our body because that glucose is a sticky substance that along with lipids in our blood, fat, those two combined can cause additional problems. Okay, so let's talk about the differences between type 1 and type 2. Does everyone kind of know that there are 2 or 3 different types of diabetes? Okay, so type 1 is an insulin deficiency. So that is your body attacks your own cells that make the insulin in the pancreas called beta cells. And, hold on. Okay, and the treatment you must take insulin by injection. Okay, so you can't take an oral insulin. Or, well, right now they do have an insulin that you can spray, but the majority of people who have type 1 diabetes have an absolute deficiency in the hormone that helps to regulate their metabolism. So it has to be replaced by an injection of insulin or by inhaling insulin. Type 2 diabetes, the body makes insulin, but it does not use it properly. So that's the majority of people. We're going to talk about statistics today and the rise in type 2 diabetes and pre-diabetes. So the treatment is healthy meal planning and physical activity, which is the first line of lifestyle modification that we recommend for all people with pre-diabetes and diabetes. Oral medications, many of you may have heard of those medications. You might be currently taking those medications. Over the years, the pharmaceutical companies and medical research has developed additional medications that are actually breaking through and helping people to live a better and fuller life by taking oral medications. You may also be familiar with the GLP-1s and the GIPs, which are hormones that can be injected, like the medications you see on TV, like Ozempic and all those medications. Those are also helping with obesity and helping the body to utilize glucose and also promote weight loss and better utilization of glucose. So we're going to talk about some of these medications as well as insulin. So there are many different types of insulin. So if you are insulin deficient and have type 1 diabetes or type 2 diabetes, you still may require, despite the fact that you're on oral medications, you may need insulin by injection to control your glucoses. So now we're going to talk about when the blood sugar is higher than normal, not yet high enough to be type 2 diabetes. What is that? That's pre-diabetes. So a lot of people ask me, well, pre-diabetes is just a little bit of sugar. It really isn't a problem. It used to be called metabolic syndrome, for anyone who maybe remembers that. And many years ago, they kind of put it in the buckets to talk more about specifically alerting the population that pre-diabetes is a precursor and an early stage of inflammation in your body and insulin resistance that can lead to type 2 diabetes or even type 1 diabetes down the road. So we really want to make sure that people fully understand the significance of pre-diabetes. It's an opportunity. Many people have pre-diabetes for many, many, many years and they're not aware of it. So we want to make sure now that your physicians, your family practitioners, your primary care physicians are all screening for pre-diabetes and making sure. And we'll talk about what tests are important. It usually precedes the development of type 2 diabetes or it goes undiagnosed. So that's the other thing that's really important to understand. Okay, so now let's talk about actual diagnosis of prediabetes. Many of you may be familiar that there's some tests that can be done, blood tests, that help to determine if you have prediabetes or diabetes. So if we look at the chart, the road to type 2 diabetes, we'll look at the 3 columns. So if you have what we call a hemoglobin A1C, which is a blood test that measures the amount of glucose in your blood over a 3-month period of time. So your red blood cells have an outer layer of protein. And if there's excessive amounts of glucose, your red blood cells live for approximately 90 days. So by measuring this test called a hemoglobin A1C, we're able to tell whether or not you have some glucose intolerance or where your level is. So what is considered a normal level for a hemoglobin A1C? It is below 5.7%. Okay, so when you go to your doctor, usually your primary care physician, or if you're going to an endocrinologist, they will measure this test usually several times a year, making sure that your hemoglobin A1C and your glucose control remains in the normal level. Our goal is to keep most patients, even with prediabetes, as close to the normal level as possible. The diagnosis of prediabetes is 5.7 to 6.4%. So that's that area right before you get the diagnosis of diabetes with this hemoglobin A1C. And then actually the diagnosis of diabetes is a hemoglobin A1C of greater than 6.5%. So it's really important that you know your values and that when you're going for your annual checkup, that you're discussing this with the doctor. You might have a family history. As we get older, we have more likelihood that we could develop diabetes. And we just want to make sure that we know what our normal numbers are and keeping track of our labs. The second way to kind of diagnose diabetes would be with an absolute finger stick, a fasting blood sugar level. And so the normal level would be under 100. So 99 would be a normal glucose fasting in the morning. So if you go to the doctor and they do a fasting blood glucose, yours should be down below 100. That means you have not eaten for at least 8 to 10 hours, and you go to the doctor and they draw your glucose and it's normal, okay? If you're in the pre-diabetes range, which is what we talked about before, which is the beginning of insulin resistance, that glucose could be between 100 and 125. And so people sometimes see a slightly elevated glucose, and they may not necessarily be alarmed by it, but it is an early sign that we want to make sure we're not missing any other glucoses that are elevated throughout the day. So that's an early sign. The second is the fasting blood sugar test, which is 126. And once it reaches that level, for fasting glucose, then that's a diagnosis of diabetes. Often in the past, they would also do a glucose tolerance test, which they would give you some glucotrol, which is a drink that you would glucola, and you would drink that, and then they would check to see your levels. After that test, when they're looking at it, the normal level would be 140. The pre-diabetes would be 140 to 199, and the diabetes rate, any random glucose over 200. So these are different ways that we can classify whether or not you have normal glycemic control, pre-diabetes or metabolic syndrome, or type 2 diabetes. These are the numbers that your physician should be looking at. Okay, so pre-diabetes and diabetes in the United States is sadly on the rise. Over the years, it's been staggering to see, not just here, but in other countries, that the rise continues. So we're looking right now at the diagnosis of diabetes, 37.3 million people, okay? That's 1 in 5. And it costs our country $327 estimated $billion. And this is a disease that we can control with good medications and lifestyle change. We just have to have awareness and education and making sure people know what is going on with their health care. Pre-diabetes, 96 million, and I'm sure that number is not even current. It's changing like the stock exchange. Every day we see more and more people who are developing pre-diabetes and diabetes. And so 8 in 10 people, adults, don't even know they have pre-diabetes. because they haven't been screened and they haven't been tested. So that's why it's really important that that's health screening test that I gave out earlier. Take that home, share it with your neighbors, your friends, your family. The more that we can get the conversation going and making sure people understand and how to reverse prediabetes by good nutrition, exercise, and lifestyle is important. So the progression from prediabetes to diabetes, 15 to 30% within 5 years go on to develop type 2 diabetes. So that's why it's critical during this early phase that we capture everyone who has prediabetes and implement lifestyle management before we need to progress to type 2. And sometimes we even need to deliver different medications. And we're going to talk about that. Okay, so the risk test that you took today, you're going to get a score. And it's looking at the areas that may really be early signs. Some things we can't change, like our gender. And so they assign a certain amount of risk based on your gender, male or female. They also assign a certain amount of risk. We know that progressively, as we get older, it doesn't mean you will develop diabetes, that your body slows down and you might have less muscle, and so therefore you might put yourself more at risk. So we want to make sure that you're understanding your risk, family risk, and being aware, so that's even more reason why you implement the lifestyle changes necessary. So what is some of the symptoms of uncontrolled diabetes? I think this is really critical because earlier we spoke about so many millions of Americans who go undiagnosed. And so some of the classic signs of hyperglycemia, high blood sugar, lead to some of the symptoms like increased urination or sudden weight loss. That is, you're not on any medications and you haven't made any lifestyle changes, and all of a sudden you're starting to lose weight. Wounds that won't heal. Okay, so if you get a sore on your foot or a sore on your arm, you notice that for some reason it's taken 6 months or a long time, several months before you heal. That may be an early sign. The sign that you're always hungry, despite what you're eating. Your body is not satiated, so you're always eating additional calories. You might have sexual problems. You may also notice if you go to the eye doctor or you're out and you have visual problems, that's another sign. As well as vaginal infections. So for women, that could be common. Again, the increased amount of sugar in the body can lead to these different signs and symptoms that you need to be aware of. Numbness and tingling in your hands and your feet. So the nerve endings are getting inflamed from the amount of glucose in your blood, and obviously covering a lot of your vessels, causing inflammatory response. Okay, and then always being thirsty, unusually thirsty. Oftentimes, that's when people are first diagnosed, when they notice they have visual problems or they're thirsty all the time. And why is that? Because the body's trying to get rid of that glucose. And in doing so, you're losing fluid. So you may be going to the bathroom all the time because it's drawing it out, and that's causing increased thirst. So here's a chart that helps you better categorize what a hemoglobin A1C and how that is equivalent to an actual average blood glucose. So a hemoglobin A1C of 6%, as we said earlier, we want the glucoses, that's about an average of 126 blood sugar, okay? 6.5, it goes up to 140. So that's at the time when we really make the diagnosis. 7% the hemoglobin A1C, the glucose, the average glucose is about 154. And for people living with diabetes, that's what we'd like them to be. We'd like their hemoglobin A1C to be below 7, ideally, okay? With type 2 diabetes, I would love to see a 6.5, but again, we want to keep those glucoses regulated and very kind of smoothly controlled, like a rolling hill. We don't want peaks and valleys of glucoses, and I'll explain why. Okay, and then it goes right on up the chart. So if you have an elevated hemoglobin A1C, of 8% or 8.5, that might mean that your glucoses at times are running as high as 183 on average. So you may have some very high and some very lows. The same with a hemoglobin A1C of 9 or 10. It could be as high as 240 on average. And that might mean you also have some high glucoses. So that's why it's really important to know what your numbers are so that you can make some changes, lifestyle changes and medication changes. So here, this gives you an example of a picture of 3 different individuals who have a hemoglobin A1C of 7%. So now we have the ability not just to do a lab test, we can also do glucose monitoring, and we can also put continuous glucose monitoring so we can really see how is someone's diabetes controlled over a 24-hour period for 10 to 14 days. And so many of you may see commercials about continuous glucose monitors. So these charts actually depict 3 separate individuals who have a hemoglobin A1C of 7%. But if you look at the charts, you can see in example number 1 that 24% of those glucoses were actually hypoglycemic, low blood sugars. So they had, in the first column, they had a glucose that was low, okay? And it went undetected, perhaps, but the only way they could see it was with their continuous glucose monitor. The second portion, which is the green, indicates a good level of glycemic control. Okay, so that's between 70 and 180, which is a goal for patients who are on glucose monitors, who have diabetes. And then greater than 180, it's 58%. So that particular patient has a lot of high glucoses that maybe they were not aware of, okay? But they still have a hemoglobin A1C of 7%. So if you're only looking at your laboratory tests, you wouldn't realize that you have a lot of variability, which is also not something we want. We want very smooth glycemic control. In the example number 2, this individual is a little bit better. They have less hypoglycemia in the purple area, so they have only 8% of low blood sugars less than 70. Ideally, we don't ever want to see blood sugars less than 70 because it can lead to lack of concentration, it can lead to dizziness, it can lead to a fall. So there's no benefit to hypoglycemia. It actually can be very dangerous. So we try to eliminate that first and at all costs, so we're not don't have patients on too much medication. And then the middle portion is the normal, 63%, which is excellent. Our goal is to usually keep most patients over 70%. And then below half is 29%, the patient's still experiencing a lot of hyperglycemia. We would like to keep that in a low range as possible. So our overall goal, if you look in column number 3, is to have at least 70 to 80%. This individual has 100% in range. So that means their glucoses are always within that 70 to 180%, and they're very, very well controlled. Okay? So that's why that hemoglobin A1C test, you have to dig a little bit deeper sometimes to make sure you're not missing high and low blood sugars. Okay, so how do we do that? We have these wonderful devices now. I've been in diabetes for a long time. Initially, we used to just use urine testing. And now, many of you who know someone with diabetes or you're dealing with diabetes yourself, we used to have to stick our finger to know what our glucose level was. That's not very easy. And if you're doing that all day long trying to control your blood sugars, it's not fun. It's not always, it sometimes can cause a little bit of pain. So now, in combination with finger blood sugar tests, we have blood glucose continuous monitors that you can wear on your body, and it's just a tiny little fiber, and it's inserted, and you can wear it for 10 days to 14 days, and it gives us 24/7, allows us to see your glucoses all day long, either on your phone or on the monitor. So that's been revolutionizing because we really can teach patients what happens when you eat certain foods, when you do exercise, what happens when you forget to take your medication, because you can see it right on your phone. And it allows us to better control your diabetes. And it helps you to make some changes in your diabetes because you can see what's happening. Okay, so now when we look at the American Diabetes Association, and this is National Diabetes Month, type 2 diabetes goals, we want to keep it below 7%, which I mentioned earlier. So let's talk a little bit more specifically about before you eat and after you eat. So before you eat a meal, the American Diabetes Association has said if you have type 1 or type 2 diabetes or prediabetes, you want your glucoses as close to the normal range as possible. So if you have diabetes, they'd like you to keep it between 80 and 130, okay? And then after a meal, we know that our glucoses rise depending on what we actually eat. So normally your glucoses go up, and your body then puts out insulin to control the levels of your glucoses. So that 1 to 2 hours after the meal, we would like it not to go too much higher than 180. Okay, so that's where we get our goals, somewhere between 70 and 180 all day long, but certainly want not to have it too much higher than 180 after you eat a meal at the 90 minutes or 2 hour mark. Now, why is it important? Glucose travels throughout our body, and poor glucose control can lead to a lot of complications that can lead to a lot of problems. So we want to talk a little bit about what kinds of complications, because I think most people associate certain heart disease and amputations with diabetes, and yet we know that we can prevent all complications from diabetes with good diabetes management. So let's talk about what other things can happen when we have poor diabetes control. It can actually affect your brain, inflammation. So now they're calling type 3 diabetes can lead to maybe some dementia. It's still being researched and explored, but high glucoses maybe can contribute to problems with a lot of people say they have brain fog and they don't feel necessarily clear when they're unable to think. Also, we know that it can affect our heart. So one of the things that's very important is we don't want plaque and glucose forming in our vessels and contributing to inflammation of the heart and the vessels and the vasculature. Our kidneys. The glucose is secreted through our kidneys, so it can cause problems with, most people are familiar, you can have problems with your kidneys over time. And so we want to really protect our kidneys. We want to protect our circulation, our nerve, and our feeling in our legs. That's our nervous system. And so that glucose and extra inflammation and plaque can cause inflammation in our veins and cause damage to not only our veins and our arteries, but also the nerves in our legs and our hands and our nerves throughout our body. Let's also talk about other complications. A lot of people don't realize that you can get dental problems with your gums and your teeth, all related to poor diabetes management, as well as foot problems, right? Which is common that most people associate that, but you can have changes in the structure of your foot because of the vessels and the nerve damage to your feet. And so it actually can affect that as well. So diabetes is a serious condition that we need to really pay attention to, and you need to have the proper education and information so that you can make good lifestyle and also get the proper care. So now let's talk about diabetes medications. So this chart is very busy, so I'm just going to tell you, as many of you know, there's a lot of medications on the market. And so when we look at these different specific medications, they are used in different types of diabetes management. So the first one is metformin, which is glucophage. And so that's usually used in type 2 diabetes for insulin resistance. And it also can be used for patients early on with type 2 diabetes to help control their insulin resistance and allow their body to utilize glucose better. So it lowers the sugar production by the liver and increases insulin sensitivity. What are some of the side effects? Well, sometimes it can cause some gas and some GI distress. So often we start patients on lower doses and then we slowly move up with the medications. And the medications do not cost a lot of money, and so patients tolerate them over time. And it's actually it's a wonderful drug for patients who have insulin resistance. Sulfonylureas or glinides, many of you might know these medications, and there's several different categories of them. They usually help the pancreas to make more insulin. They can cause low blood sugar, unfortunately, so we have to be very careful that patients are utilizing these medications. They know what to do and report if they have low blood sugars, which is a glucose less than 70, because we don't want hypoglycemia. And some of these medications, if you don't eat your meals on time, or if we increase your medication to control your glucoses, they may actually cause some low blood sugars. So we're often, with any good effect of a medication, sometimes there are some side effects. So that means you have to properly communicate with your team about what medications you're taking. The TZDs, these medications are not used as frequently, but they also are very helpful with insulin resistance. They help the body use its own insulin better. And they can though, unfortunately, cause some swelling and weight gain. So we have to be careful with certain patients, particularly with heart failure. So there are many medication choices, but we also have to weigh out the pros and the cons, right? The risks and the benefits to see which medication is best for the individual patient and their type of diabetes. And a lot of patients have other chronic conditions like heart disease or renal disease. And so we have to look at all the medications they're on and make sure that we make good choices based on their medical history. Okay, the new medications that have been out for the past decade are SGLT2s, which are inhibitors. And those medications you may have heard, like Jardiance, there's lots of commercials now on TV, so it's very confusing. Invokana, for all of these different category of medications, but they work a little bit differently because they eliminate excess sugar through the urine, so through the kidneys, and they flush out that excessive amount of glucose, and that helps to control the glucose and eliminate it in the urine. It can also have healthy benefits for the heart and for the kidneys. So that's why right now those medications are often used for both heart patients as well as patients with kidney issues. The problem with some of those is it can also cause some yeast infections, and like all medications, there's some side effects. So we want to make sure that we don't have urinary tract infections. It can cause diabetic ketoacidosis if you're in the hospital. So we have to be very, very careful with who we prescribe these medications for, even though they have wonderful benefits. So now let's look at the next group of medications called DPP-4s. And these medications increase insulin production by the pancreas. So if you have type 2 diabetes and your pancreas is just a little sluggish, it can actually help to produce and decreases the sugar release by the liver. So it works in combination and it helps to control the glucoses. It can cause some side effects like stuffy nose or a cough, or oftentimes sore throat. And it also it's weight neutral. So a lot of medications can cause some weight gain, but the majority of these medications cause weight, keep your weight stable, but it doesn't really help with weight loss. So that's why sometimes we have to use a combination of different medications, because you can see they each have different actions, and so we want to promote what's best for the individual, what's best with your other chronic diseases, so we can pick medications that we know that you can tolerate and that are going to help control your diabetes. And then the GLP-1s, many of you may have already heard, these are oral medications that are helpful with controlling your diabetes. They increase insulin production when the blood sugar is high, but they also decrease sugar release by the liver, and they're also known to help with weight loss. So a lot of new medications, they're using both for obesity and also to help your glycemic diabetes control. So those medications, many of you have heard, and I'm sure a lot of people are on those medications now. So we're using a combination, as you can see, of all different medications to help based on the individual's needs. Also, we have a lot of injectable medications. So these medications are used in combination. They increase insulin production when the blood sugar is high, and they also decrease sugar release by the liver. So they can also help to curb and decrease your appetite. So they can cause nausea, vomiting, diarrhea, and constipation. So unfortunately, until you can tolerate these medications, we titrate them very slowly and make sure that you're able to tolerate and not have any problems with the medications and still achieve those goals. We also use insulin. So patients who have type 2 diabetes and type 1 diabetes, despite everything that they're doing correctly with their other medications, over a period of time, the pancreas sometimes just stops producing their own insulin, or you need additional insulin to help. So you could be on all of these oral medications or a combination of the medications, but sometimes your pancreas is just sluggish and not working well, so we have to actually replace the insulin that your body normally would have made. And so we really instruct patients and work with patients and the doctors to try to find out the right combination of medications and tailor it to the individual. So what do you consider when choosing all these medicines when you go to the doctor? It's a lot to take in, right? All these different medications have different actions. What ones do you tolerate? So some of the things that we suggest that you consider and discuss with your team is, what's my current hemoglobin A1C? And how much needs to be lowered? So if your diabetes is well controlled, and you're also incorporating lifestyle management, which we're going to talk about, those glucoses, some medications may just be to help you assist in getting your diabetes under control. The number of years with diabetes is something that we have to consider, because the longer you have diabetes, over time, if you are not able to incorporate changes and your body's just not able to control the glucoses, then we have to make additional adjustments in your medications, and we take those into account. Your body weight. Over time, We want you to stabilize your body weight, lose body weight, and also gain muscle so that you can help with your metabolism. And a lot of people think that just by taking medications, it's going to just fix everything. And it's a combination of both that we really want to make sure. But people struggle with weight gain because as we get older, our metabolism changes, and some different medications can also lead to weight gain. And we also lead a very sedentary lifestyle. We sit often. So we're going to talk about the importance of incorporating other lifestyle skills to help you maintain a healthy body weight. Other illnesses. So some people have other chronic diseases. They might have kidney issues. They may have heart issues where they're taking a lot of medications. And those in combination can lead to weight gain, which then leads to diabetes. So we might not be able to prevent those other illnesses, but we really want to co-manage them with their other teams to make sure we're using all the right medications to help improve their control. Also, the cost of medicines and insurance, we have to take that into consideration, right? Because I can prescribe, or the doctors can prescribe, all those medications we just talked about. But if your insurance won't allow you to get those medications, or you have a high copay, therefore you're not going to take your medications, then that's not really a good plan. So we really like to work with our patients, look at their insurance policies with them, we look at the copays, and we try to pick medications that we know will work and help them with their diabetes management, but that they don't have exorbitant costs in terms of the medication fees. And then lastly, we want convenience, and we don't want the diabetes plan to take over your life. We want to teach you, okay, this is the best time to take your medications, these are the best ways to take them, these are the other things that are important, because your treatment plan has to be something that we agree on and that you're going to actually be able to do when you go home. So diabetes prevention management, let's talk about the lifestyle changes that we need to make. So can type 2 diabetes be prevented? Absolutely. It can be controlled. It can't always be totally eliminated, but we can certainly get our diabetes well controlled. And we have the national government several years ago produced a program called the Diabetes Prevention Program. And it was designed to take patients who have pre-diabetes and type 2 diabetes and help to get them into a year-long program to use lifestyle. And you can see in this diagram that one group had medication and the other group had lifestyle, and the group with the placebo that didn't have it actually did well with this program. So it's a combination of education and lifestyle changes that we can prevent diabetes from progressing. So let's talk about the things that we need to do. And unfortunately, we've become such a sedentary society. Many of us sit a lot, so what I tell my patients is, on average, what do we need to do to stay healthy? So the physical guidelines are that we need to get exercise approximately 150 minutes, okay, which is about 20 to 30 minutes a day to get up and move. So walking and doing exercises, and we need to incorporate flexibility, balance, and training is also very important. So walking is the first step because everyone can walk. You can get a partner, you can get out and start to exercise. But we also know that by not just moderate exercise, that we have to also build muscle. So what is the benefits? And I think if we talk about what the benefits of physical exercise, people will begin to realize it's going to make you feel better, and how is that? So it helps to lower the blood sugar that's in your blood. It also helps to improve cardiovascular risk benefits. It helps to achieve or maintain healthy weight. It increases strength, ease of movement, improves posture, and balance and independent living, all of which we need as we get older. So we have to think about, how am I going to stay healthy and active? We have to start to incorporate these things into our daily routine. Improving quality of life. Okay, so exercise just helps you to reduce stress. It increases your energy level. It helps to improve your sleep. So 20 to 30 minutes a day, even if you break it up 15 minutes in the morning or 15 minutes in the afternoon. Even people who work full-time, I say get up and have a working meeting. You know, use your lunchtime to go out for a walk after you have your meal. All of these things help with your diabetes management. So let's talk about tips that you can use. So start slow, right? Check with your health provider, number one, to make sure it's safe and easy to do. and that there's no problems with an exercise routine. And then make it fun. Usually I suggest getting a friend or a buddy, either a coworker or someone who lives in your building, or someone that, you know, if you have headsets. I have friends who live on the East and West Coast, and we sometimes walk together, so we can have a conversation, and we go out and talk and catch up, but we're out and we're walking. Check your feet to make sure you have properly fit shoes, because we don't want to cause any problems. We don't want anyone to fall. So we want to make sure you're equipped, you have, you know, identification on you, and you're safe when you're doing exercise. We want you to stay hydrated, so drink fluids when you exercise, after you exercise, and actually carry a water bottle if you're going to be out for a long period of time. Always be prepared. If you have diabetes and you've ever experienced the low blood sugar, you want to make sure that you carry something with you all the time. So patients, sometimes their glucose goes down because your body with the exercise is utilizing glucose. So you really want to make sure that you're prepared and you have a snack with you. You have some glucose tablets or a juice box in case you're on medication that causes low blood sugars. And then if you have a lot of low blood sugars or any low blood sugars when you're exercising, you want to make sure you talk to the doctor, because maybe you're doing well and your blood sugars are better controlled and we can actually cut back on your insulin. So the next thing we want you to consider is keeping track of your daily steps. And I think that's an incentive, right? If you go out and you walk and you start to make small steps, you start to feel good about things. And if you're tracking how you're doing and you're meeting your goals, that's going to be really helpful in terms of your overall controls. And set realistic goals. Don't say, I'm going to walk 10 miles today. Start small, pick a friend, and start your activity in a realistic setting. Okay, so now, go ahead. So now we're going to talk a little bit about the importance of nutrition. And I'd like to just bring up 4 basic principles that some of you may already be familiar with, especially if you have diabetes. You want to first follow my plate for balanced eating. We're going to talk a little bit about that. You want to use smart, be very smart about the type of carbohydrate choices you make. And we'll talk about what is a good carbohydrate choice. I think a lot of times we can be fooled by all the manufacturers and the labeling in stores, so you want to be kind of a little bit more aware. You want to limit any added sugar, so that you need to be reading food labels, and you want to understand the food labels, so you want to know how to use it. So, how many of you understand the plate method? Has anyone ever heard of that? Okay, so you want to make sure that you're having a balanced plate, and that you have a really great, a quarter of your plate, if you divide your plate in half, a quarter of your plate should be full of nice, good sources of protein. Half your plate should be fruits and vegetables. So really salads, different types of vegetables, high in fiber. So if you look at that colorful side of the half of the plate, that's going to provide you with a lot of fiber and a good source of nutrients that you need. And then that other quarter of the plate is the protein, and then the smaller part of the quarter of the plate, the second part, is carbohydrate. So you want to pick good sources of carbohydrate. So we also want to be smart about the type of carbs that we're using. So let's look at healthy choices. How many people know healthy choices of carbohydrate? Show of hands. It's kind of confusing, right? So let's look at this top list. So non-starchy vegetables, greens, broccoli, cauliflower, those are healthy choices. Even vegetables have some carbohydrate. Starchy vegetables, potatoes, corn squash, whole grains, brown rices, barley. Can everyone read? Okay. Some whole grain pastas are better, cooked al dente. Whole wheat breads and cereals, legumes, milk and plain yogurt, whole fruits. All of these types of healthy choices, you can still eat and make wonderful meals. Less healthy choices are the refined grains, so the white breads, the rice, the bagels, the muffin, the things that we see around us all the time that we probably eat on a regular basis. Flavored milk and yogurt sometimes has a lot of sugar and carbohydrate. Dried fruit, canned fruit with syrup and juice you have to be careful about. Sweets, of course we know, ice cream and candy, especially around the holidays, which seem to be all the time. Snacks, which are available, processed snacks like pretzels and chips and so forth. And then sugar-containing beverages like fruit juices, smoothies, and soda. So those things we need to eliminate because they're not healthy for us. And yet we can really enjoy a lot of other flavorful, healthy foods. We just have to make the right choices. So tips to choose the high quality. Choose whole grains such as whole wheat pasta and brown rice rather than white flour and white rice. Look at the package that says 100% whole wheat or 100% whole grain. Okay? At least, the least processed, the better. So, like for instance, with oatmeal, you would want to get a steel cut and cook it so it still has some fiber and slow, as opposed to like an instant oatmeal. Okay? Eat fruits rather than drink fruit juices. And I always tell people it's better to keep the fiber. So if you're going to have an orange, as opposed to a glass of orange juice, because you're going to get the fiber as well as the good nutrients. Beans and lentils do not cause the same blood glucose rise because they have a lot of fiber as well. So you want to really have good combination and good choices. Okay, so now we're going to look at, let's compare these two breakfasts. Which one do you think would be a healthier breakfast? The one on the right, my right, your left, is a bowl of cereal, and it does have fruit and it has milk, so it's all a lot of carbohydrate, versus the breakfast on my left, your right, is whole wheat toast with avocado and some vegetables and an egg. So which one would you think would be a better choice? Okay. And why would you think that would be?
The protein.
The protein. That helps to slow down the absorption, but it also has a lot of rich nutrients, fiber, and good sources of carbohydrate. Now we're going to look at a lunch meal. So on the right, my right, we have chips and a nice big hoagie sandwich full of processed meats, versus on the left side, my left, your right, is a nice big salad with also a sandwich, but it has a combination of food. So which one do you think would be better? Okay, terrific. So starting to make good choices and adding different sources of food at all your meals helps to slow down the rise of the glucose, and it's healthier in terms of your overall. You're getting all your nutrients. You're getting your proteins, you're getting your carbohydrates, a good source of carbohydrate, and you're also getting a source of fiber. So we're going to talk a little bit about working with your healthcare provider. So today was just really an overview of, do you hopefully understand the differences between type pre-diabetes, type 1 diabetes, and type 2 diabetes, and understand that it takes a combination of medications and monitoring, meal planning, and also exercise, but it also takes a plan. And you have to be educated and have a team that helps you to kind of develop the right plan using all of these tools. So it's not just like a prescription that they can write and say, okay, here, take this and go home. We work with patients to kind of really understand, what is your lifestyle like? What kind of work do you do? What kind of foods do you like to eat? Do you prepare your own meals? Do you have access to good foods? Do you have grocery stores close by? Do you take public transportation? Do you work the night shift? So we really get to know our patients and ask all these really critical questions, because if we don't understand how you go home and live with your diabetes, then we're not really helping you to make the better choices and put together a plan that's going to work for you. So hopefully we're going to open for some questions. If anyone would like to ask a question, I'm more than happy, and Dr. Jack is here on the phone, so hopefully she'll be able to assist.